You said something about women are living longer with metastatic breast cancer. Pia and I'm sure everyone hears that a lot. Could you say a bit more about the reality of that?
Yeah, so I think a very good example of that is the ribociclib and palbociclib, so our CDK4/6 inhibitors for hormone-positive breast cancer, which really have revolutionised the amount of time people are on their first-line treatment for that type of breast cancer. Prior to having access to those medications, people might have been on their aromatase inhibitor for a year. Maybe if we're really lucky, they might have got 2 years out of it, and then we're having to switch on to a different endocrine therapy. But with these new medications, that's more than doubled the average time that ladies are able to stay on that first line of treatment. And certainly I have patients that have been on that first line of treatment and blown the trial data out of the water and are still on that first line of treatment after 5 or 6, 7 years. And that is happening not only in hormone positive breast cancer, but we're getting new medications in HER2 positive breast cancer as well, new antibody drug conjugate medications, so fancier versions of things like TDM1 or Kadcyla, which are coming through, and also in triple negative breast cancer as well, so medications like sacituzumab govitecan or SG, which is less of a mouthful, which has become on the PBS just during the last 12 months. And in addition, in the triple negative breast cancer space, immunotherapy as well. So with every new drug that we get listed and become available, that's more months of good quality of life that we can hopefully give to our patient. Often when I meet someone and I give them an average of, I always ask whether patients want to know those figures to start with, because sometimes it's very confronting and some people don't have any interest in knowing that. They just want to see how they will go personally. But I always preface that with these new treatments and new trials are coming out all the time, and likely where we're going to be in 5 years is not where we are now.